Do you guys know how to tell if you have an issue with your jaw or your TMJ? I'll show you a couple things that you can look for with this. So we say TMJ, it's temporomandibular joint. When we find issues there, a common diagnosis is TMD, or temporomandibular dysfunction. We see this often in our office, and sometimes we'll catch it. People don't realize that they have an issue with it. So just by making them aware that they do, that's part of the solution, is to make sure that they fix some of the things that they're maybe not even aware of. So the jaw, or the joint itself, may not necessarily be the issue. Sometimes it can be. We'll use a provocative test if we do find somebody. We'll really compress down on that joint. And honestly, it's pretty rare that we find that there's something as far as the structure of the joint being wrong. Most of the time it ends up being mechanical. So some things that we always want to ask patients is, obviously, are they having any pain there? But also it can present with other things as well. Sometimes that pain can actually radiate. It can radiate to the ear. There's a couple muscles, our masseter, deep to that is our pterygoid. It can radiate to our ear. Sometimes it can radiate to our teeth. We get a lot of referrals from, we do get some referrals from dentists where, it feels like it's a toothache, and it ends up actually being something with their jaw. A lot of times we get referrals from dentists just because they have trouble opening and closing their jaw. So they may not have a lot of pain, but they are having trouble when they try to eat or something like that. And that's something else that's telling you that you have a little bit of an issue with the jaw as well. It can also refer up in this area too. So you might have headaches with it as well. And then the other symptom is you could get some clicking or popping too, okay? So those are the kind of things that we always ask our patients. And then a couple other things that you can kind of check on your own is how well does your, what kind of issues do you have with your bite? So when you clench down on your teeth, does it feel equal? And what I mean by that, are you hitting one side of your mouth or one side of your teeth versus the other? Are you bumping into the front part of your teeth when you try to clench down? Those are all issues that are going to show that you might have an issue with the jaw. And again, a lot of this is mechanical. So when we treat this, obviously we feel like we're really good at the manual therapy part of it. So we do spend a lot of time treating some of the muscular issues that can cause some of it. But the other big issue is we have to be aware that the jaw is not, it's not an issue just because of the jaw itself. It really depends on what's going on with it, kind of as a whole. So, and what I'm talking about there is maybe some postural issues. And the best example I can kind of give to this is when we have maybe somebody with really bad slump posture. We'll ask them to check their bite and it doesn't feel normal. We ask them to sit up a little bit straighter. Oh, that feels better. And you can kind of check that on your own. So maybe you feel like you have really good posture. You kind of clench, it feels okay. You kind of slouch forward and you feel it change. And that's just how it relates to how well we are as far as keeping an upright posture, because the pivot of this is going to change as we start to slouch forward. So obviously when we treat it, again, we don't just pay attention to that jaw, we want to see how everything else is moving. So a couple things that we might have patients do as it relates to posture. A common one is we may have them work on some chin retractions. So what that looks like, I'm going to turn to the side here, is we pull that chest up high, we pull that chin back, and we're doing a couple things. So when my head gets forward like this, the top of my spine is not over the bottom of my cervical spine. When I pull that chin back, I get nice, good alignment. I still have a normal curve in my neck, but the top and the bottom, if I hang a plumb line there, everything looks really good. So that's our goal with that. And we use this kind of as a micro break. So maybe somebody is at the computer a lot all day, maybe they're in their car a lot during the day. So they got to be able to work in some of these throughout the day. If there's issues with weakness, we may have to address that because they might just have trouble getting in that position. Another thing that we see a lot with the issues with the jaw, and again, is we might just have to have that conversation and figure out, hey, there is something going on with the jaw. That's why you're having your headaches, or that's why you're getting the pain, around the ear. And we always ask, is the pain worse in the morning or is it worse as the day goes on? If it is worse as the day goes on, and that means probably throughout the day, they're clenching quite a bit. And this usually is, a response to, maybe they have a stressful day. Maybe they just picked up a really bad habit of doing that. And so they have to be able to catch themselves doing that. And then the micro break that we give for that, we ask them, okay, when you find yourself clenching your jaw, you take your tongue and you put it to your roof of your mouth, right in front of your teeth. And all you're going to do is hold it there, but also open your jaw. And it's just a 10-second hold. We can't clench and hold our tongue to the roof of our mouth at the same time. And if you're consciously aware that you're doing that, that's a way to give yourself a break of always clenching down. But again, a lot of times if somebody's just aware, hey, I'm clenching again, and they find a way to stop it, that really helps kind of clean up a lot of this stuff. On the other side of that, if they do say, well, the only time my jaw hurts is when I wake up in the morning, or the only time I have these symptoms wake up in the morning, and we're seeing some of these jaw issues, then there's a chance that they might be doing some of that clenching at night. And unfortunately, you can't consciously make that change. So a lot of times we have to kind of co-manage this with a dentist or somebody who does prescribe a mouth guard to be able to wear at night. And that usually ends up, taking care of some of that clenching that happens at night. So, but those are the couple things that we will usually recommend, just kind of is taking or giving yourself a little bit of a break throughout the day from doing that. But again, if there is a postural issue, then we might have to go a little bit deeper. We might have to look for what areas in the spine are really restricted, what other areas are a little bit weak, and we might have to address those as well. So I hope that was helpful. What we'll do is we'll keep this conversation going, and maybe next time I talk to you guys, I'll show you a little bit more of how we treat it in the office. So thanks, guys. Appreciate it.